It's not often that a paper is going to change my practice, but this one from the American Journal of Sports Medicine genuinely will. Welcome to Sunday Paper Roundup, where I read the papers so you don't have to. I'm back in Blighty after spending some time in Flowrider. This week's paper is a systematic review from Jorge Chala's group at Rush, one of the major centres in modern sports knee surgery. Jorge is a machine, already in the sports knee GOAT conversation, a future Hall of Famer, the Messi of menisci if you like, and I spent time at Rush with the legendary Brian Cole during my Winston Churchill Fellowship back in 2014. This paper asks a really practical question. If a medial meniscus posterior root tear presents late, is a repair still worth doing? This review included 11 studies in 366 patients looking at outcomes after meniscus repair performed at 3 different time points: within 3 months, between 3 and 6 months, and after 6 months. What did they find? Across all the timing groups, repair led to a significant functional improvement. Patients treated within 3 months, though, had the biggest gains in IKDC and lifetime scores. But importantly, even the delayed group having surgery after 6 months still displayed significant improvements in both. So the key message is, this paper does not tell us that timing no longer matters. It tells us that delay is not automatically disqualifying. Why does this matter? Because the classical thinking and mainstream practice is, if you leave a meniscus root tear too long, the meniscus extrudes, deforms, scars down, becomes very, very difficult to mobilize, hard or impossible to reduce, and is no longer repairable in any meaningful way. That concern still makes sense biomechanically, and the paper here doesn't really disprove that. In fact, the authors acknowledge that in more chronic cases, the root may scar to the medial joint capsule, creating extrusion that may be harder to treat without meniscotibial ligament repair and centralization techniques. And that's important because increasingly many of us are not just pulling the root back, we're also trying to free it up, mobilize it, reduce the extrusion and control it better, sometimes with meniscotibial work and centralization. So this paper shouldn't make us complacent. There are some real strengths to the paper looking at the critical analysis. It asks a clinically relevant question we all face on a weekly basis. It includes timing subgroups that are actually useful in practice. It shows that even a delayed repair can still meet meaningful improvement thresholds in selective patients. But there are some notable limitations. This is not high-level comparative evidence. Most included studies were retrospective case series with no direct head-to-head comparative studies by timing. Extrusion data were limited and inconsistent. Only one study in the delayed group showed a significant reduction in extrusion. Failure rates range from 6% to 21%, but without a consistent association with timing. And osteoarthritis progression was reported across all groups, which reminds us that meniscus root tears remain serious injuries even when repaired. So this paper does not give us a clean cutoff for when a tear becomes irreducible. It doesn't prove that late is just as good as early, and it does not justify delaying referral. For me, the take-home is quite simple. Diagnose these early, refer these early, repair early where appropriate, because earlier repair still appears to give the best outcomes. But if a patient presents late, don't automatically write the tear off as unsalvageable. And that is the part of the old thinking that this paper softens. So what's my verdict? Should you ignore it? Should you be aware of it? Should you consider it? Or should you go ahead and change your practice? My verdict, go ahead and change your practice. Not by delaying surgery, early still looks best, but by not assuming that a late presenting root tear is automatically beyond repair. This paper suggests delayed repair can still be worthwhile in the right patient, even if extrusion, chronic deformation, and reducibility remain very real concerns. See you next Sunday. I'll keep breaking down the evidence as it lands.